Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, and welcome back to Straight Up with Steph. I'm Steph, practicing dental hygienist and ergonomic specialist, and today we are talking about ergonomic loupes. True blue, legit ergonomic loupes. These are one of the most innovative and helpful ergonomic tools in dentistry. I think that they are a no-brainer for anyone working in the field. And today we're going to talk all about them. I recommend these loupes for everyone, whether you're a dental hygienist like me, a dentist, dental assistant, periodontist, oral surgeon, anyone. As we all know, posture and ergonomics is a big problem in dentistry. All you have to do is Google pain rates in dentistry, and you will see that no matter what position someone's in, whether they're a dental assistant, dental hygienist, if they're a dentist or specialist of some kind, we all have pain rates up in the 90%, which is crazy. It is way too high, and it doesn't need to be that way. But a lot of this pain and a lot of our issues trace back to two things: our posture and our ergonomics in the operatory. So what we're talking about today improves both your posture and your ergonomics. I can attest to it personally because I practiced for a long time with traditional loupes, and then I made the switch to ergo loupes, and I am never going to go back. So today I'm going to talk about what they are, what the differences are between them and traditional loupes, and then I'll answer some of the more frequently asked questions that I get on social media about these loupes. Before we get into the loupes, we do have to talk just for a minute about posture. On the last episode, we talked a lot about neutral posture. I'm not going to go into everything that I talked about in the last episode, don't worry, but I do want to hit a couple points. So when we're talking about head position, we want our head up and back with our ear in line with our shoulder. That is a neutral head position. So our head isn't forward, our head isn't tipped down. It's nice and neutral. That is the healthiest posture for our spine and our head. But there's so many loupes out there, and I'm really sorry to say this, but not all loupes are ergonomic loupes. They do provide magnification, which is great, but I was one of these also, but I still see so many clinicians using loupes and they are hunched forward, straining, trying to see into their patient's mouth. That is not an ergonomic loupe. Something that's ergonomic supports us in neutral posture. So we need something that will allow us to keep our head fully upright and back. That's what these ergonomic loupes do, as opposed to some of the traditional loupes. This forward head position, if you've heard of text neck, tech neck, nerd neck, it all refers to the same thing. When the ear is way out in front of the shoulder, because we're like hunching down, looking at something like our cell phone, all you have to do is go out in public for a little bit, like at a coffee shop or a restaurant or something, and you will see people hunched over their phones, okay? And remember that form follows function. So the longer we're forcing our body into this hunched over posture, it's going to start remembering that posture, and then that's going to become our normal. It doesn't look good, it doesn't feel good, and it's really not good for our body. But if you look at people hunched over their phone, just think that's how we look in dentistry most of the time. Okay, we're hours and hours a day hunching over our patients, not to mention after work or before work or whatever. When we're looking at our cell phone, we're hunching over. When we're on our laptops, we're hunching over. Usually when we're driving, we're straining our head forward. That adds up to hours and hours and hours at the end of the day when we're hunched over. So having something that will allow us to have a better posture while we're seeing patients is huge. Speaking of cell phones and laptops, on the last episode, I did talk about some tips to help you have better posture with both of those. So I'll link that episode down in the comments. Okay, back to these ergonomic loupes. I'm going to demonstrate the differences between ergonomic loupes and traditional loupes. So if you are listening to this on your phone, I strongly encourage you check out the YouTube video so that you can see what I'm doing, but I'll try to be clear as I'm going through this. Okay, so I'm going to put my ergonomic loupes on now. So I'm going to sit sideways so that you can see me, and I might have to move away from the microphone a little bit, so it might sound a little weird, but I have my ergonomic loupes on now. And if you can see the scopes, where are they? Right here. So this is the scope. This is the part that my eyeball is looking through. And if you see right here, there is a bend in that scope. So it's like the scope starts out straight and then it bends down and points downward. I don't know what is in here. I've never seen the inside of this, but there's some kind of prism or mirror or something that we're able to look through the scope, but then I can see down, like I can see my hand right here. Okay, I can see it clear as day. And look at my head. It's fully upright in a neutral position. So let's pretend I've got my little alien. You might have seen him in some of my videos, but I'm going to pretend like he's my patient. So with my head neutral, I can see right here in his mouth. Okay, I'm not tipping my head forward. I'm not leaning forward. I'm able to work just like this. This is neutral posture. This is what we want when we're working in the operatory. Now I'm going to switch to my traditional loupes. Okay, so I've got my traditional loupes on. These are through the lens loupes. And if you look at the scope, it is pointed down a little bit. Point it down as much as the manufacturer can while still making this functional. So if I'm wanting to work on my patient, this is what I have to do. I've got my patient down here. And if I want to see into his mouth, I have to do this and this. Lean my head forward and down. You can see here, my ear is not in line with my shoulder. It's several inches forward. And every inch forward, the ear is out in front of the shoulder. That's adding 10 extra pounds of pressure to the spine. So if my ear is 3 to 4 inches in front of my shoulder, like it used to be with my traditional loupes, I'm adding 30 to 40 extra pounds of pressure to my spine that doesn't need to be there. No wonder we end up with so much pain. So you can think about these loupes like looking through a microscope. Usually when people are looking through a microscope, they're looking through the eye thing, right? I don't know what the technical name for that is. But because of the design of the microscope, they're able to see down onto the slide, or if you've seen people use this in dentistry, like endodontists, they can see down into the patient's mouth while having really good posture. It's kind of the same concept with these ergonomic loupes. I've used these ergonomic loupes for a few years now, and I will never go back. Unless something happens where I break the nose piece and I have to send it in and then have to go back to my traditional loupes, like what's happened before. But when that happened, I felt that pain and that cramping and that tightness after the very first patient. So I know these loupes make a big difference. These are one of the biggest reasons that I can have such good posture while I'm seeing patients from any clock position. And speaking of clock positions, that leads me to one of the most frequently asked questions that I get is, can you use these from any clock position? The answer is yes. Once you get used to them, which I'll give you some tips here in a little bit on how to adjust to them, because it is different. It takes a little bit of an adjustment period. But once you get used to them, just like your old loupes, you can use them in any clock position. I would be very surprised if someone uses their loupes for a 9 o'clock position and then has to take them off for an 11 or 12 o'clock position, right? That would be kind of not effective. It's the same with these loupes. Once you get used to them, you can use them for everything you would with your traditional loupes. Side note on clock positions, I will be making an episode on clock positions, so don't worry, but I wanted to give this quick tip. No matter what clock position you're in, you always want to be squared up. And what do I mean by that? I talk about this a lot in my lectures, but you want everything pointed in the same direction. So when you're sitting chair side, no matter what clock position you're in, you want your head, shoulders, hips, legs, feet, everything pointed in one direction, which is towards the patient. What we don't want to do, and what I see a lot, and I used to do this too, is our legs are pointed up towards the head of the patient, but we're twisting and then working on our patient from the low back. That's a twist. We don't want to do that. So just quick tip on clock positions, try to make sure everything is squared up when you're chair side. I get questions on the weight of these. Aren't they heavier? Not necessarily. A lot of the, especially the newer ergonomic loupes, are just as light as traditional loupes. And of course, the weight could increase if you add illumination, right? If you add a headlamp, whether that be wired or wireless, that's going to add some weight to it. But I want to explain why weight isn't really a big concern when we're talking about ergonomic loupes. When we're talking about traditional loupes, weight is a concern because a lot of times we're forward, right, and down. Any weight here is going to be pulling on our head, and we're going to be fighting against that weight. Even if it's a few grams, that makes a big difference after like an 8 or 10 hour day. And that's because the head is not in a neutral position, and those muscles are just straining to hold up the head. If you want more information on that, please refer to my previous episode, which I'll link down below. But when we talk about ergonomic loupes, our head is upright. Our spine is holding up our head. It's nice and solid and it's stable. That's how it should be. So even if the loupes are heavier by a few grams, it doesn't make that big of a difference because we're nice and stable and strong here and we can handle more weight on our head. Like I've seen pictures of people walking around with big like packages or big baskets on their head. They're able to do that for hours sometimes because they're in a neutral position. Their spine is aligned. They can handle that weight. We can handle a lot of weight if our head is in the right position. But just imagine if someone like that was hunching over with their head forward and down and then having that weight on there, I mean, that wouldn't work, right? That would kill their neck. That's kind of what we're doing to ourselves in dentistry. So don't let weight deter you when you are looking at ergonomic loupes. I get a lot of questions on patient positioning, especially what if the patient can't lean back? If our patient can't lean back for whatever reason, that's going to be a challenge regardless if we're using ergo loupes, traditional loupes, or no loupes at all. It's hard, right? Sometimes people are under the impression that they're going to get these ergo loupes and all of their postural issues and patient positioning problems are going to disappear, which is not true. They help a lot, but if your patient positioning is off or if you're not using indirect vision, there's still going to be some issues. When we're using traditional loupes and our patient won't lean back all the way or can't lean back all the way, what are we doing? We're usually hunching forward, right? We're kind of hunching over them, trying to see down into the patient's mouth. With ergo loupes, it's almost the opposite. We're not going to be able to have completely neutral posture. You can't if your patient isn't in the correct position. But with these ergo loupes, you're kind of doing this thing, like tipping your head back and then looking through the scopes at them. So traditional loupes, you're forward, ergo loupes, you're back like this. Either way isn't great. So it's really good to try to master your patient positioning. Patient positioning is one of the most important things for us when we're chairside, and their position dictates ours. And we want to have good posture, right? So we have to make sure that we have our patient at the correct level. One quick tip for you is when you're in neutral posture, that means your elbows, like your head is upright, like we've already talked about. Your elbows are at your side and they're bent at about 90 degrees. If you look down at your elbow, that's where you want the patient's mouth to be, not up here. You want it down here, right at elbow level. That is going to be a nice neutral position for you. But I will create an episode on patient positioning. I also have a whole on-demand video-based course that goes over patient positioning that I'll link down in the comments as well. It goes over exactly how to position your patient. And I also talk about these. These are patient positioning cushions. This isn't like a cushion that you bring from your house or one of those big dog bone cushions. This is a cushion that really helps control the occlusal planes. And it keeps your patient comfortable. So it does both. The patient feels like they're getting pampered, but we're actually using this in a specific way to control the occlusal planes. And I go over that in that course as well. I'll go ahead and link these cushions down in the description with a discount code as well. And what about doing injections? Yes, you can do injections with ergonomic loupes. I use my ergo loupes for any injection I'm doing, whether it be the upper or the lower. What I do, and this is very similar to when people are using traditional loupes for injections, is you're not looking through the scopes first. What I do, I have my loupes on, but I'm looking around the scope. I'm grabbing my syringe. I'm making sure my patient's okay. I'm establishing my landmarks. I bring my syringe into where it's in my line of vision, and then I switch my eyes through the scopes, locate the syringe, and then I proceed with the injection. It's the same concept when you're using traditional loupes versus ergo loupes for an injection. Another tip on injections is I really recommend standing. I recommend standing at least 50% of the time if you can. When we stand, we're using different muscles, we're increasing blood flow, and it just feels good. So I recommend people stand for injections. I mean, you're not having to worry about the foot pedal, so you can stand, and your posture and your ergonomics is so much better. There's no more chicken wing when you're standing, and you can see a lot better too. So strongly encourage you to try that out. I also have a free operator positioning course that I will also link in the description. A lot of links today, but that goes over how to incorporate standing into your day. Sometimes people wonder if there are certain things that they have to use their regular loupes for versus their ergonomic loupes. This has not been my experience. I use my ergo loupes for everything: polishing, oral cancer screenings, flossing, scaling, doing injections, anything. The only time I recommend switching is when you are getting used to these. So I'll talk about that more in a minute, but I do recommend that people bring both their ergonomic and their traditional loupes to work and go back and forth between those until they get the hang of their ergonomic loupes. That's the only time I recommend switching. And if you break your nose piece, you'll have a backup pair. Remember when you first started using your regular loupes, like when you switched from no loupes to using loupes, it was a bit of an adjustment, right? But once you got over that hump, it became second nature. And it's the same with these ergonomic loupes. Yes, they are different. So there is a bit of an adjustment period. So when I first started using mine, I realized how strong muscle memory is because every time I put them on, I would automatically tip my head forward. And then I had to remember, oh yeah, I don't need to do that and bring my head back up. But when I first started using these, I experienced some dizziness and kind of that choppiness with your vision. My neck and my back muscles got kind of sore for the first week or so because if you think about it, you're using your muscles. This is a good thing, but you're using your muscles differently than in a better way than when you're hunching over. There is some muscle activation, which can cause some soreness, but that's normal. When I first got mine, I didn't even take them into the office yet. I practiced filing my nails at home. I was writing in my journal, coloring. I was going to say you could chop some veggies, but that's probably not a good idea. So maybe just stick with filing your nails or writing or something. But then once you get the hang of that, you can bring them into the operatory. And this is when I recommend using your ergo loupes every other patient or maybe once every 2 patients or something, just so you can get used to it. It took me just a matter of a few days of doing that and still practicing at home. And then it just clicked in here. And then I haven't gone back. If you've looked at ergonomic loupes, you may have noticed the magnification is a bit higher. And sometimes this freaks people out. But let me explain why there is a higher magnification with these. It's not like the tooth is going to be blown up huge, okay? But let me explain. So when we have our head up and back, we have a longer working distance between our eye and the patient's mouth. I am a huge fan of a long working distance. That's going to help you keep your arms down, keep your shoulders down, and then have your patient's head at the correct level. Because you have such a longer working distance now, they need to up the mag to make up for that. When I very first started using ergo loupes, I got a 4.0, and that was very comparable to a 2.5 that I had been used to. I've had the opportunity to try a couple different types of loupes. I tried a 4.5 and a 5. I now use the 4.5, and that's my favorite. The 5 for me was a bit much. I just don't think that I needed all of that, but just take this with a grain of salt. Magnification is a personal preference. So just because that works for me doesn't necessarily mean that it's going to work for you. So you can try these at conferences or at trade shows if you want to, and just kind of play around with the different magnifications. And the reps that work for these companies are very kind, they're very knowledgeable, and they'll be able to help steer you in the direction that you want. I also get questions about the reduced field of view. You can still, even if you're looking through the scopes, you can just look outside of the scopes for a minute and use your periphery and check on your patient. You can even move your head a little bit if you need to. You can turn and look at the computer if you need to, and then get back to work. It's really not that big of a deal. A quick tip, if you're thinking about purchasing ergonomic loupes, the best time as far as price is to get them at a conference or a trade show if you can. So maybe your local association meeting, maybe a bigger conference like RDH Under One Roof or Chicago Midwinter. But it's a great opportunity where you can physically put them on. You can try the different magnifications. Usually at the booth, they have some kind of setup that mimics what you would experience in the operatory. So you can get set up and see what your working distance would be and just kind of play around with them a little bit. I do lectures and CE pretty often on dental ergonomics. And depending on the program, sometimes you can get great discounts with those courses as well. Here's a tip for when you're being measured for ergonomic loupes. Make sure that you are in neutral posture because the position that you're in at the time of measurement is going to be the position that you're going to have to use when you start using these loupes. What do I mean by neutral posture? Again, you can refer to my previous episode, but it means your head is up and back, ear in line with the shoulder, and you want the patient's mouth about at your elbow level. That's going to be neutral posture. I do a lot of ergonomic assessments for dental clinicians, and it's so sad when I see them using loupes, but they're still hunching over and straining, and they have their patient way too high because whenever they were measured in an incorrect position. So now their working distance is really short, and they're forced to work in this hunched over posture. That is not an ergonomic loupe. So just make sure that you're in neutral position when you're being measured. But no matter if you get a screaming deal or not, these loupes are a no-brainer and really, I think, a necessity for anyone practicing dentistry. Sometimes people get turned off because they see the price. The prices are pretty comparable to traditional loupes, by the way. But it's hard to spend that much money, right? Whether it be ergonomic loupes, a saddle stool, new instruments, new handpiece, whatever it is. But these are literal investments in our health and longevity. So if you think of someone who, or maybe you, go to the chiropractor or go to the massage therapist, PT, acupuncture, doctor visits, maybe miss time off work because of pain, all of those expenses add up. And what if we could use a tool like this that would prevent us from experiencing a lot of those issues and having to shell out all that money? It makes sense, right? I think there's absolute value in PT and chiropractic care and massage therapy, but I don't think they should be used as a band-aid for improper ergonomics in the operatory. It makes more sense to me to fix problems at the source, which is, in this case, our posture. If we can get our posture under control, we can prevent and reduce a lot of these visits and a lot of this money that we have to spend. So that's all I have for you today on ergonomic loupes. If you have any more questions, please enter them in the comment section on YouTube, send me a DM, and if you're finding this content helpful, please subscribe to my channel, follow my show, leave me a review. I would really appreciate it. Thanks for being here, and I'll talk to you soon.